Hi friends, I am Dr. Toishi Sharma, Interventional Cardiologist, and today we will understand how is a heart blockage percentage measured accurately. So, when we say a patient has a 70% blockage in their heart artery, how do we know it is 70%? And more importantly, how do we know if it really needs treatment? Today, I am going to walk you through exactly how cardiologists measure blockages, from quick visual estimates to cutting-edge imaging that's accurate to the fraction of a millimeter. So friends, the most common way of measuring a heart blockage is during an invasive coronary angiogram, which is the gold standard for our patients. We inject contrast dye into your heart arteries, take X-ray images from multiple angles, and compare the narrowest part to a nearby normal section. This gives us a percentage of diameter stenosis, for example, 70% narrowing of the proximal LED. But here's the catch. Visual estimation can be off by 10 to 15%, and that's why, friends, we have more advanced tools these days. So, my friends, that brings us to the segment 2 of quantitative coronary angiography. So, because of this issue with visual estimate, with quantitative coronary angiography, software analyzes the imaging and calculates the narrowing more precisely. It is better than what we can see with the naked eye, but it still relies on the 2D images of a 3D artery. So friends, this quantitative coronary angiography, which relies on a software, is better than visual estimate, but it still has less efficacy than intravascular imaging. And this brings us to my favorite topic, intravascular imaging. So friends, for the highest accuracy, we use intravascular imaging, which could be in the form of IVUS or intravascular ultrasound or OCT, meaning optical coherence tomography. So friends, these are tiny ultrasounds or light-based ultrasound, which travels inside the artery, measuring the exact cross-sectional area and the plaque burden. Compared to IVUS, OCT actually has incredible resolution, up to 10 times higher even than ultrasound. This is how we know narrowing to within fractions of a millimeter. And now friends, since we have understood how to accurately determine the percentage with the help of intravascular imaging, this topic will not be completed till we talk about functional tests. Because friends, the percentage of the blockage is not the whole story. Why? Because 70% narrowing in one person might not cause significant blood flow limitation, while a 50% narrowing in another patient might be significant. That's where the importance of hemodynamic significance comes for a patient. And therefore, we measure how much the blockage actually reduces flow. And this is done using DFR, IFR, or FFR. Through this, we actually understand what is the flow distal to the lesion compared to the proximal lesion. And that's why this technique is called functional techniques of determining the hemodynamic significance for you as a patient. Friends, finally, let's talk about CT coronary angiography. This is a very newer technique. It's a non-invasive technique and it's great for detecting moderate or severe blockages. The only issue is that it is not quite as precise as invasive imaging or to decide whether or not we should intervene, because usually the result is something like mild, moderate, or severe and not the exact percentage. But it can still be a great screening test if coronary artery disease is suspected. So friends, to conclude, from quick visual estimates to high-tech imaging inside your arteries, we actually have many ways to measure blockages. But the best approach combines anatomy and functional assessment, as we discussed. If you found this breakdown helpful, please hit a like and subscribe for more heart health demystified, and drop your questions below for my next video. Thank you.